Have you ever been sitting comfortably on your couch, maybe reading or watching television, and suddenly notice that your feet feel like blocks of ice? Or perhaps you've been out with friends and found yourself embarrassed to shake hands because your fingers are freezing cold, even though everyone else seems perfectly comfortable. If you're over 55, you've probably experienced this more times than you can count. Cold hands and feet aren't just uncomfortable. They can disrupt your sleep, make it difficult to enjoy activities, and leave you wondering if something is seriously wrong with your circulation. The good news is that in most cases, cold extremities are not a sign of a dangerous medical condition, but they are a sign that something has changed in your body, and understanding what's happening can help you address it effectively. Let me explain what's really going on. Your body is an incredibly sophisticated temperature regulation system. Your core needs to maintain a temperature of about 98.6 degrees Fahrenheit for all your vital organs to function properly. Your brain, heart, liver, and kidneys cannot tolerate much variation from this temperature. But your hands and feet? They're expendable from your body's perspective. When your body senses that it needs to preserve heat, it doesn't treat all parts equally. It prioritizes your core, the central part of your body where your vital organs live. To do this, it constricts the blood vessels in your extremities, your hands and feet, reducing blood flow to these areas. Less blood flow means less heat delivery, and that's why they get cold. This process is called vasoconstriction, and it's controlled by your sympathetic nervous system, the same system that manages your fight or flight response. When you're cold, stressed, or your body perceives a need to conserve heat, it sends signals to tighten those blood vessels. Now, why does this become more pronounced after 55? Several things are happening simultaneously in your body, and they all contribute to colder hands and feet. First, your metabolism slows down as you age. Metabolism isn't just about how many calories you burn. It's about how your body produces heat. Every chemical reaction in your cells generates heat as a byproduct. When you're younger, your metabolic rate is higher, which means you're constantly generating more internal heat. As your metabolism slows, you generate less heat, and your body becomes more conservative about where it sends that heat. Second, your circulation changes. The walls of your blood vessels become less elastic with age. They don't dilate and constrict as easily as they once did. Think of them like old rubber bands that have lost some of their stretch. This means that even when your body wants to send more blood to your hands and feet, the vessels don't respond as effectively. Additionally, many people over 55 start to develop some degree of atherosclerosis, a buildup of plaque in the arteries. Even mild atherosclerosis can reduce blood flow to the extremities. You might not have any symptoms in larger arteries, but the smaller vessels in your hands and feet can be affected. Third, your muscle mass decreases with age, especially if you're not actively working to maintain it. Muscle tissue is metabolically active. It generates heat even when you're at rest. Less muscle means less heat production, which means your body has to be even more conservative about distributing the heat it does produce. Fourth, hormonal changes play a role, especially for women going through or past menopause. Estrogen helps regulate blood vessel function and circulation. As estrogen levels decline, blood vessels may not respond as well to signals to dilate, and circulation to the extremities can decrease. Your autonomic nervous system, which controls automatic functions like heart rate and blood vessel constriction, also becomes less responsive with age. It might overreact to cold temperatures or stress, constricting blood vessels more than necessary. There are also some medical conditions that become more common after 55 and can contribute to cold hands and feet. Hypothyroidism, an underactive thyroid, slows your metabolism even further and can make you feel cold all over, but especially in your extremities. Diabetes can damage nerves and blood vessels over time, affecting circulation and temperature sensation. Raynaud's phenomenon, a condition where blood vessels in the fingers and toes overreact to cold or stress, can develop or worsen with age. Certain medications can also contribute to the problem. Beta blockers, which are commonly prescribed for high blood pressure and heart conditions, can reduce circulation to the extremities. Some medications for migraines, decongestants, and even some over-the-counter cold medicines can cause vasoconstriction. So what can you do about it? The solutions are more straightforward than you might think, and they work by addressing the underlying mechanisms we just discussed. Start with movement. This is perhaps the most effective strategy. When you move, your muscles contract, and contracting muscles generate heat. They also pump blood through your vessels more effectively. Even simple movements make a difference. If your feet are cold while you're sitting, try wiggling your toes, rotating your ankles, or tapping your feet. If your hands are cold, make fists and release them, rotate your wrists, or rub your hands together. Better yet, get up and move your whole body. A brisk 5-minute walk can raise your body temperature and improve circulation to your extremities for hours afterward. You don't need to exercise intensely. Just moving regularly throughout the day keeps blood flowing. Build and maintain muscle mass. We talked about how muscle generates heat. Strength training, even light resistance exercises with bands or small weights, can help you maintain muscle tissue. More muscle means more metabolic heat production, which means warmer hands and feet. You don't need to become a bodybuilder. Simple exercises 2 to 3 times a week can make a noticeable difference. Pay attention to your core temperature. This might seem obvious, but many people dress for how they want to feel rather than how they actually feel. If your core is cold, your body will absolutely sacrifice your hands and feet to keep your organs warm. Layer your clothing. Keep your torso warm with a vest or sweater. Wear a hat when you're outside because you lose significant heat through your head. Here's something interesting. Keeping your core warm is actually more effective for warming your hands and feet than just putting on gloves or thick socks. If your core is warm, your body relaxes the vasoconstriction in your extremities because it doesn't feel the need to conserve heat. Blood flows more freely to your hands and feet, and they warm up naturally. Stay hydrated. This surprises people, but dehydration can worsen cold hands and feet. When you're dehydrated, your blood becomes slightly thicker and doesn't flow as easily through small vessels. Adequate hydration keeps your blood volume up and flowing smoothly. Aim for 8 glasses of water a day, more if you're active or in a dry environment. Limit caffeine and nicotine. Both are vasoconstrictors. They tighten your blood vessels, reducing blood flow to your extremities. If you're a coffee lover, you don't necessarily have to give it up completely, but be aware that it might be contributing to your cold hands and feet. Consider reducing your intake, especially in the evening. Nicotine is particularly problematic. If you smoke or use tobacco products, quitting is one of the best things you can do for circulation. The effects are often noticeable within just a few weeks. Manage stress. Remember how vasoconstriction is controlled by your sympathetic nervous system, your stress response system. Chronic stress keeps this system activated, which means chronic vasoconstriction. Practices like deep breathing, meditation, gentle yoga, or even just taking regular breaks to relax can help calm your nervous system and improve circulation. Consider your diet. Certain nutrients support healthy circulation. Omega-3 fatty acids, found in fish like salmon and sardines, or in flax seeds and walnuts, help keep blood vessels flexible and reduce inflammation. Vitamin E, found in nuts, seeds, and leafy greens, supports vascular health. B vitamins, especially B12, are important for nerve function and circulation. Iron deficiency can make you feel cold because you're not carrying oxygen efficiently in your blood. Spicy foods, particularly those containing cayenne pepper, can temporarily increase circulation and help you feel warmer. Some people find that adding a little spice to their meals helps with cold extremities. Keep your thyroid in check. If you're experiencing cold hands and feet, along with other symptoms like fatigue, weight gain, or feeling cold all over, talk to your doctor about having your thyroid function tested. Hypothyroidism is very treatable, and correcting it can resolve the cold extremities along with other symptoms. If you have diabetes, managing your blood sugar levels is crucial for maintaining healthy circulation and nerve function. Work closely with your healthcare provider to keep your blood sugar in the target range. For some people, contrast therapy can be helpful. This involves alternating between warm and cool water. Fill 2 basins, one with comfortably warm water and one with cool, not ice-cold water. Soak your hands or feet in the warm water for 3 to 4 minutes, then switch to the cool water for 30 seconds to 1 minute. Repeat this cycle 3 to 4 times, always ending with warm water. This helps train your blood vessels to respond better, improving their elasticity and function. At night, if cold feet are disrupting your sleep, wear socks to bed. Some people resist this because they think it means something is wrong, but there's nothing wrong with giving your feet a little extra help staying warm. You might also consider a hot water bottle or heating pad to warm up your bed before you get in. Just make sure to remove or turn off the heating pad before you fall asleep. During the day, keep your hands and feet protected when you're outside in cold weather. Wear warm, insulated gloves or mittens. Mittens are actually warmer than gloves because your fingers can share heat. For your feet, wear thick socks and insulated waterproof boots. Make sure your footwear isn't too tight, because that can restrict circulation. Here's an important point. You should talk to your doctor about cold hands and feet if they're accompanied by other symptoms. If you notice pain, numbness, tingling, color, changes like your fingers or toes turning white or blue, sores that won't heal, or if one hand or foot is significantly colder than the other, these could be signs of a circulation problem that needs medical attention. Also, if your cold hands and feet are severe and persistent despite trying these strategies, or if they're interfering significantly with your quality of life, it's worth investigating further. Your doctor can check for underlying conditions and may refer you to a vascular specialist if needed. For most people, though, cold hands and feet after 55 are a normal part of aging that can be managed effectively with the right approach. It's about understanding that your body is changing, that it's prioritizing your vital organs, and that you can support it in maintaining good circulation to your extremities. Think of it as a partnership with your body. You give it the fuel it needs through good nutrition and hydration. You generate heat through movement and muscle. You protect it from excessive cold. You manage stress and avoid substances that constrict your blood vessels. In return, your body will do its best to keep you comfortable, warm, and healthy. Cold hands and feet might be common after 55, but they don't have to be something you just accept and suffer through. With understanding and the right strategies, you can keep your extremities warmer, more comfortable, and healthier for years to come.